Hello, my name is Jarislady, and now I'm going to read about the unit 14 to 24. First, complete the table with the words from the opposite. No and adjective. No, exhaustion, adjective, exhausted. Fatigue, fatigue. Lethargic. Tiredness, tired. Point 2. Make word combination using a word from each box. Complain of, out of, present, put one, with, of, out, on, color, sort. 1. Complain of. 2. Of color. 3. Out of sorts. 4. Present with. 5. Put on. 6. Worn out. Point 3. Complete the sentence with the correspond to the present, the verb present. A 67 years old man present with a 9-month history of increasing shortness of breath. The most common presentation, loss of consciousness. 3. Cranial arteritis may present as fever without any obvious causes. 4. The patient usually presents with a severe sore throat. 5. The presenting symptoms in the patient could perhaps be due to renal failure. 6. Other conditions with a similar presentation include acute cholecystitis. 7. Reduced growth in an important presenting complaint of celiac disease. 8. 2 months following presentation, the patient was able to walk. Point 4. Read the patient description of her symptoms. They complete the case report. I was well until a few months ago. In the beginning, I just fell off color and I'd be tired. But lately, I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've been put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 30. A 50 years old housewife who had been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight. In the year before she presented to her GP also, she didn't eating more than usual. She was constipated and she noticed that her hair had started to fall out. Unit 15. Find words in the box with the opposite meaning. Adequate, inadequate. Against, for. Insidious, sudden. Likely, unlikely. Severe, mild. Rare, common. Point 2. Make word combination using a word from each box. 1. Bone marrow. 2. Differential diagnosis. 3. Insidious onset. 4. Iron deficiency. 5. Pernicious anemia. 6. Progressive increasing. 7. Vibration sense. Point 3. Complete the sentence. A 39 years old man present with a history of progressive abdominal distension over a period of 6 months. 2. Blindness might be caused by vitamin A deficiency. 3. The bleeding and purpura are caused by abnormal platelet function. 4. The white cell count is normal, so we can exclude acute leukemia. 5. The yellow color of her skin and conjunctive is probably due to jaundice. 6. There was a pulpate mass in the right upper quadrant of the abdomen. 7. Treatment is aimed in restoring fluid balance with adequate intravenous fluids. 8. The anemia may be due to increased red cell breakdown. Point 4, complete the conversation. Professor, what is against the diagnosis of pernicious anemia on physical examination? The problem started quite suddenly, so it didn't have the typical insidious onset. He doesn't have any skin pallor, and he doesn't have symmetrical prosthesis or absent vibration sense. And I couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore. Unit 16.1. Label the diagram using word from the box. 1. Skull. 2. Jawbone. 3. Spine. 4. Breastbone. 5. Rib. 6. Collarbone. 7. Shoulder blade. 8. Thigh bone. 9. Kneecap. 10. Shin bone. Point 2. Match the type of fracture with the description. 1. Open. Letter A. There is a break in the skin. B. The bone is bent. It occurs mainly in children. Wearing stick. C. The bone is broken into several pieces. Community. D. The broken pieces are separate, displayed. E. The broken pieces are pushed together, impacted. Point 3. Complete the textbook extract. Reducing a fracture involves trying to return the bones to as near to the original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on to malunion. Unit 17.1. Complete the table with word from A and C opposites. Verb, delay. Noun, delay. Adjective, delayed. Develop, development, develop. Distend, distension, distended. Fail, failure, failing. Nourish, nourishment, nourished. 1. Babies with the fetal alcohol syndrome may present with failure to drive. 2. Abdominal distension may be due to a larger liver. 3. Small amounts in alcohol in pregnancy can affect fetal development. 4. Mortality from measles can be reduced with better nourishment. 5. Delay in one or more of the milestone may be the first sign of disease. Point 2. Complete the sentence. Look at the A and C opposite to help you. 1. After sitting, babies learn to crawl and tend to walk. 2. A child who has started eating solid food has been weaned. 3. Someone who is not very tall is said to be of short stature. 4. The stage in a child's development are now at the milestone. 5. A child who is beginning to be developed sexually has reached puberty. Point 3. Write a common English name for each disease using your medical knowledge. 1. Enlarged parotid glands, mumps. 2. Difficult opening the mouth, lockjaw. 3. Rash and enlarged posterior occipital nose, German measles. 4. Paroxysmal cough with vomiting, whooping cough. 4. Oh no, 5, sorry. Papillon vesicles. First on trunk, chickenpox. 6. Cough and cold, followed by rash, measles. 7. Sore throat and rash, scarlet fever. 8. Swallowing joints and a hair marfar. Traumatic fever. 9. Fever followed by muscle weakness, polio. 10. Cough with stridor, croup. Unit 18.1. Complete the table with the words. Verb, inhabit. Noun, inhabitation. Produce, production, sorry. Relax, release. Replace, replacement. Secret, secretation. Stimulate, stimulation. Point 2. Complete the passage from a textbook using the illustration. Pools of GnRH gonadotrophin release hormone are released from the hypothalamus and stimulate testosterone production from leading source of test. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH secretion. ESH stimulates the systolic cells of the seminiferous tubulus, produce mature sperm, and the inhibits A and B inhibits cause feeding on the pituitary to decrease FSH secretion. Point 3. Complete the sentence. 1. A diffuse change affects many parts of an organ or gland. 2. Localized change affects only one part. 3. His diet is deficient in iron. He doesn't get enough iron. 4. Excess T3 and T4 increase the basal metabolic rate. Point 4. Match Mr. Davis' symptoms with the question her doctor asked. A. Do you prefer hot weather or cold? Heat intolerance. B. Is your weight steady? Weight loss. What is your appetite like? Eating more. D. Are you bowel normal? Diarrhea. E. Are you able to sit and relax overactive? F. Do you handshake? Tremor. G. Have you ever feel for hair beating heavily or irregular? Unit 19. Complete the table with the words. Verb, accommodate. Noun, accommodation. Not adjective. Constrict, constriction, constrict. Converge, convergence. Not adjective. Delayed, dilatation, dilatation. Delayed. Drop, not noun. Dropping. Oscillate, oscillation, not adjective. Reacts, reaction, not adjective. Match the picture with the condition. 1. Skin. 2. Irregular pupil. 3. Delayed pupils. 4. Constrict pupil. 5. Cataracts. 6. Dropping of lids. Point 3. Complete the extract from a textbook. Retinoscopy. Examine the retina with an ophthalmoscope, if possible with the pupil dilated, to obtain the maximum view. Look for papilloedema and or flame shape, hemorrhage, and cotton wool exudate. Assess the stage of the arterioles and note the presence of any narrowing, as well as nipple arteriovenous crossing. Unit 12. Complete the case report. Point 1. Physical examination revealed a thin girl with a slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius. Pulse 100 minutes. Blood pressure 110 80 milligrams. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not extended. There was general tenderness, which is most marked in the right lower quadrant and was associated with warming, but not rigidity. There was no rebound, tenderness, and no masses. Where felt bowel, some were reduced. Point 2. Match the description of the stool. 1. Gastric ulcer, black terror. B. Irritable bowel syndrome, small heart. C. Ulcerative colitis, loose bloody. D. Cholera, clear, watery with mucus. E. Celiac disease, loose, pale, bulky. F. Obstructive jaundice, clay chloride. Match the features to the doctor's question. How often do you open your bowels? Bowel habit. Are you going to the toilet more often than normal? Sorry. C. Are the motion hard or loose? Consistency. Do the emotion have an unusually smell offensiveness? E. What about the appearance of the stools? Color. F. Have you passed black stools? Blood. G. Is the size of the amount of the stool normal? Bulk. Point one. Write a simple English phrase of the medical terms. Point two, read the conversation between the gynecologist and the patients in C opposite and complete the notes. Menage, 2 years. 12 years. Menstrual cycle, 4, 5, or 28. LMP, 152 ago. Menorrhea? No. Dysmenorrhea? No. Discharge? White discharge. Now, point three. Now write the question that the doctors ask. Menage, how old were you when you started your periods? Menstrual cycle. How long do the periods last usually? LMP. When was your last period? Menorrhagia. Would you say they are light or heavy? Do you get clots? Dysmenorrhea. Do you get periods pains? Discharge. Is there any discharge between the periods? What color is it? Point four, completed case report. A 45 years old woman had been having prolonged periods lasting for 8 days with the passage blood. For 9 months, there was no bleeding between periods, or after intercourse, her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a copper coil was fitted. She had had a normal pregnancy when she was 25. Point one, complete the conversation. Doctor, what seems to be the problem? Patient, I been getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I be had hair problems for years. What with the tiredness and shortness or breath? In the end, I couldn't walk more than 100 meters without having to stop. I have to sleep on 3 pillows. I have a mitral valve replacement 2 years ago, and that improved things for a while. Point two. Make word combination using a word from each box. 1. At first. 2. Atrial fibrillation. 3. Cardiac output, cardiac failure. 4. Heart failure. 5. On effort. 6. Bleeding or edema. 7. Premature beats. Point 3. Write the words a patient would use to describe the symptoms below. 1. Dysmenorrhea, breathlessness, shortness of breath, arrhythmia, palpitation, irregular heartbeats. 3. Orthopnea, breathless while lying flat, edema, swelling. Complete the case report. Case 30. A 60 years old woman attended her GP surgery complaining of breathlessness on exercise. This had been increasing over the previously 8 months until it was predicting problems at around 500 meters walking on the level. There was no history of chest pain. She had several episodes of fast palpitation which lasted 20 or 30 minutes and were associated with some shortness of breath. She had noticed some swelling on her ankles by the end of the day. These disappeared overnight. Point one, complete the table with words. Verb, auscultate, noun, auscultation. Examine, examination. Inspect, inspection. Palpate, palpation. Percuss, percussion. Point two, put the step for staining the hair and circulation in order. A. Measure the hair size. 5. B. Are there any murmurs? 6. C. Filter radical pulse. 2. Look for clubbing. 1. C. Locate the apex heat. 3. F. Note any thriller 4.3. A doctor is presenting the case of a 43 years old woman at a meeting in the cardiology department. On examination, she was pediatric with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130/80 and her JBP was up 5 centimeters, showing normal movements with respiration. Her peripheral pulse were all present and there was no central or peripheral anosis. Her apex beats was displaced to the anterior auxiliary sign, but still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it noted that she had pain systolic and diastolic murmurs, her beats at the apex. When she was examined some hours later, there was a harsh vertical fixation probe all over the precordium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent concert of pericarditis and atrial fibrillation. Point 1. Make the two part of the sentence. Number 1. 1988 saw the UK launch of Live Attenuate U. Oh, yay. 2. Chickenpox, varicella is a common infection. E. 3. Rabies has an incubation. 8. 4. The patient remaining febrile. Age 5. He has admitted with a 4-day history or influenza-type syndromes of fever with B. Rigors, malaise, and general malaise. 6. Quiet a proposition of patients who recover from hepatitis B. C. Become carriers of the virus. 7. The central part of Africa is in the midst of an epidemic of AIDS. 8. Measles rubiola is most infectious during the catarrhal stage. 9. Lyme disease is caused with transmission of border ferry from animal to man by exotic tick. 10. PUO stand for E. Pyrexia of unknown origin. Point 2. Complete the case report of the patient in A opposite. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpitated spleen. The combination of fever and rigor in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admits he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Point 3. Complete the sentence. Look at B, A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word from an epidemic is outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is a febrile. 5. The common infection with Epstein-Barr virus is known as glandular fever. Thank you.